This video will demonstrate how to view a patient's scanned discharged record. Please understand that approximately 2 to 3 days upon a patient's discharge or service date, the patient's scanned record will be viewable in the Meditech EMR. I'm going to access the physician desktop. For today's demonstration, I am going to click on Inpatient. I will be presented with my list of patients associated with me. Single click on the patient you are seeing today so that the patient is highlighted green and click Open Chart to launch the EMR. I am launched into my patient and their current visit. At this point, we always suggest that you view all visits past and present for the patient so that you can have a cumulative review of the patient's chart. To do this, you will want to click on Other Visit, and you will be brought to a listing of all the patient's past visits. Here, you can choose which visits you want to view for your patient. If you only care about inpatient and outpatient visits, such as lab and radiology, you can choose just those types of visits by clicking on them. Note that they are highlighted green. If you are interested in inpatient, emergency, and outpatient, choose all three. Once you have selected the visits you are interested in, click View All. From here, you can navigate through the EMR as you have been previously trained. First, if you are interested in the patient's advanced directive status, this can be viewed under the Summary tab and then the Risk Legal tab. Note the little camera. This indicates that a scanned image exists for the patient. For the advanced directive, if I click the camera, I can view my patient's advanced directive. You always want to look for the most current visit to view. To navigate through a scanned document, if multiple images exist, I can click Next Page, Previous Page, or I can select the page that I want to view. When I am done looking at the scanned image, I'm going to click the back button to return to the EMR. To continue on with our navigation through the EMR and scanned documents, if I click the Other Reports tab, this is where the bulk of the documents needed for review of patient care resides. Here I can see my transcribed reports, emergency department information, cardiology information, and surgery information. To allow you to more easily find the document that you are looking for, if you click on Report, you sort your documents alphabetically. You can also click on Date to sort by service date if you wish. Note that a document that has a report bubble indicates that this is a dictated report. And if a document has a camera, this indicates a scanned document. For example, this history and physical report has a bubble. This means that this is a dictated report. However, this history and physical report has a camera. This indicates that this was a handwritten scanned history and physical report. Note the Systems tabs under Other Reports. If you are looking for a specific item, such as surgery information, cardiology information, or emergency information, you can click on these tabs to narrow down the information that you are looking for. If you want to review the patient's discharge medication list, I have my report sorted alphabetically. I just look for discharge medication list, I click on the camera, and I launch to the image. Again, note that if multiple pages are present, I can click on Next, Previous, or the pages to my right to navigate through the document. If I want to zoom in to better view the document, I can zoom in or I can zoom out. Also note from here you have the ability to print if you need to print the document. To return to my EMR listing, click on the back button. If I need to review past provider progress notes, these are located under the Notes tab. Click the Provider tab, and these are where the scanned provider notes are located. Also note here that any other vital clinician notes are located here as well. Physical therapy, support services, other, nursing, and again, if scanned images are available, you will see the camera as you see here. If I need to review past provider orders, these are located under the Order History tab. I need to select the visit that I want to view. Note here, the green dot indicates my current visit, so I'm going to select a past visit. And I'm going to look for the camera to pull up my provider orders. And this concludes the demonstration of viewing scanned documents within the EMR.